Welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly. So I had a patient this week. I had multiple patients this week, and I noticed that there was a little bit of a trend. A lot of them were coming in, it'd been a couple months, and I asked them, were they having any side effects with their GLP-1 injection? And they were like, yes, actually, I'm so glad you asked. I've been having this nausea, or I've been having this constipation. It wasn't enough for them to stop the medication, but it definitely was enough for them to feel that it was a problem, that they needed to be addressed. And so I realized there are probably many people out there who are having these side effects, and they're like, it's not enough for me to stop, but I'd prefer not to have it. And so I wanted to do this episode where we kind of discuss what are some ways and strategies that we can help with these side effects. Now, I will say that this episode is for educational purposes only, not deemed for medical advice. It is important that if you have a serious side effect, that you let your primary care or your obesity medicine specialist or whoever is prescribing this medication for you know, because there are some things that we do need to we need to evaluate further and make sure that you're not having. So just, make sure to be mindful of that. Now, when we look at the history of these hormones, the GLP-1s, they are part of a class called the incretin hormone. Incretin hormones are a natural hormone that help regulate appetite, blood glucose levels, and digestion. And the first incretin hormone was discovered in 1970 by John Brown, and that was called GIP. This stands for glucose-dependent insulinotropic polypeptide. The second hormone that they discovered was GLP-1 in 1987. And GLP-1 stands for glucagon-like peptide. And so, these hormones were just recently, or in 1970s, found, but then 18 years later, in April of 2005, now the FDA approves the first GLP-1 receptor agonist medication called exenatide or Byetta. And Byetta is a twice-a-day injection for the treatment of diabetes. Now, how do these hormones work? So these hormones work, these receptors, GLP-1 receptors, are found throughout the intestine, the stomach, the brain, the pancreas, the kidneys, and heart throughout the body. And they have multiple functions. They can increase insulin secretion, they can increase glucose utilization, and increase glucose uptake and glycagon synthesis in the peripheral tissues. Now you may be like, well, what does that all mean? So what that means is, especially for somebody who has diabetes, when somebody who is living with diabetes eats food, their stomach breaks them down in small bites. Then the nutrients gets absorbed from the intestine, and it goes through the blood, or the blood sugar goes through the blood, and it gets utilized in the different tissues, which are the muscle, the different organs, the fat, the heart. They utilize this sugar for nutrients, and so that the body can run. Now, in somebody who's living with diabetes, that process doesn't work quite so well. Meaning that their stomach, takes the food, breaks it down into sugar, and it transfers to the blood. But the peripheral tissues, the muscles, the organs, they do not take it from the blood and utilize it for energy. And therefore that sugar stays in the bloodstream and keeps increasing. And that's why you see people who are living with diabetes have high sugar levels. They can get super high at some point, and not everybody, some people have a higher than lower sugar level. So it just depends on the person, but this can increase. And so with that being said, the way the GLP-1 receptors work is that they help balance that out, where you have the peripheral tissues taking that sugar and utilizing it. And so there's less sugar left in the bloodstream and less sugar left to cause havoc. Now, the other thing that it does, it delays gastric emptying, where it slows it down. You're not as hungry. You're full. You're fuller when you eat. You don't eat as much food because of that. Also, it helps with protecting the heart, improving cardiac function, and protecting the vessels, and also increasing neuroprotection, which is important, and reducing addictive behavior. So it has many, 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 many different function. Now, some of the benefits of the GLP-1 is that, like I mentioned, it helps with improving your diabetes control. It reduces appetite. It decreases your food intake, and it improves cardiovascular outcomes. And that has been seen in 3 of the GLP-1 receptor agonist medications, such as liraglutide or Victoza or Saxenda, semaglutide like Wegovy or Ozempic, and dulaglutide like Trulicity, that all have been shown to reduce cardiovascular outcomes. Also, Also, there are some phase 3 trials that are looking at the treatment of heart failure, peripheral artery disease, diabetic kidney disease, metabolic liver disorders like NASH or NAFLD, even looking at neurodegenerative diseases, disorders like Parkinson's and Alzheimer's. So hopefully when these trials come up, we can see if these medications are helpful in this particular population. Also, for addiction, they've noted people who take this medication have less opiate cravings as well. So, all these medications, they do have a good purpose. They help with, not only improving the diabetes, helping the heart, but they can have some side effects. And some of the most common side effects are going to be your nausea, your vomiting, your diarrhea, and constipation. And so today we're going to talk about how do you manage these symptoms. Now, I will say everyone's different, so not everybody gets all of these symptoms at the same time, but definitely it could be something that can be a struggle and can be very uncomfortable. So let's first start off with constipation. Now, I will say there's probably multiple strategies that you can use for constipation. This is not an exhaustive list, but just some options and things you can try. And once again, make sure you check with your doctor first to make sure they're okay with you trying some of these strategies. So if we look at naturally, it is important to increase your water intake. At least 64 ounces or 6 to 8 glasses of water a day is recommended. Now, you could do more, which is even better, but at least 64 ounces. And the reason being is that with the water, it helps with coating the stool. It helps with allowing it to move, your bowels to move a lot more regularly. So that is important. Also, increasing your fiber intake is extremely important as well. So eating at least 20 milligrams of fiber a day. And you may want to check it, because I have some people that tell me, oh yeah, I eat salad and everything. But what we're finding is that salad doesn't have as much fiber, maybe 4 grams of fiber. And if you're looking for 20, you are missing 16 grams of fiber. That's the only thing you ate. So check to see what you're eating, because I remember when I checked, I was surprised. I was like, I eat salads all the time. What do you mean I'm not getting enough fiber? So just check, and you can do like a quick, just look at the nutritional label under fiber to figure out how much fiber is in that food that you're eating. Some other foods that are high in fiber to consider, your prunes. You can get prune juice. They have dried fruit that these a little bit better. Okra, green leafy vegetables. These are things that have a lot of high fiber in food. So coffee can be a natural stimulant. It can help with moving your bowels. And then magnesium as well. So eating magnesium-rich foods can help with not only relaxing the muscles, but drawing the water back into the intestine. And so some magnesium-rich foods can be green leafy vegetables, beans, lentils, avocados, bananas, seeds, nuts, and oily fish, like mackerel, can all be high in magnesium and help with bowel movement. Also, some people use olive oil or flaxseed oil, put a couple teaspoons in some water and drink it to stomach, and that can help with kind of moving along their bowels. Also, avoiding refined and artificial foods will be so helpful, because these foods aren't necessarily natural and they can cause more constipation. So it's important and you can try foods that contain less fiber and replace them with beans, whole grains, fruits, plums, pears, apples, apricots, berries that can help improve digestion. Also avoiding cow's milk, because cow's milk can lead to constipation. So cheese and milk commonly can cause a lot of digestive issues. So avoiding that as much as possible. Drinking ginger tea can help with moving the bowels a little bit more. And then last but not least, there's medications over the counter, such as stool softeners, laxatives, and there are 2 prescribed medications that we use, Linzess and Amitiza, to help. Now, how do you manage the diarrhea? You definitely need to rehydrate, drink lots of fluids, eating foods or drinks that are high in sodium and potassium, such as broths, bananas, and boiled potatoes. Eating foods that are low in fiber, such as yogurt, lean meats, noodles, and trying the brat diet, bananas, rice, applesauce, or toast. And so this can help with, slowing down your bowels if you are one of those who are going to, this soup that. Also, you can avoid certain foods you should avoid that can put pressure on your gut, such as high-fat foods, including fried foods, chips, pastries, foods containing artificial sweeteners, foods that are high levels of fructose, fatty meats, or bacon. and just high fiber foods such as beans and vegetables if you're having diarrhea. And then over the counter, you have Imodium AD or loperamide that can help. Now, if you are experiencing a lot of nausea and vomiting, couple things that you can do. Usually the nausea can occur when you start the medication or you go up on the dose. So just be mindful of that. Sometimes I have my patients take the medication at nighttime or when they're sleeping, just so that if they do experience nausea, they're sleeping through it. The other thing is nausea can occur if you haven't eaten or if you are overeating. So sometimes these medications make it so that you don't feel hungry, but you still need to eat because your body needs calories to run. And if you don't eat enough, what happens is your body may be get into a stalemate. And so, or what I describe starvation mode, and it makes it harder for them to want to lose weight. And I see that a lot with my patients. They complain that, my weight is stalled out. And I'm like, well, how much are you eating? And I'm like, you're eating under 1,000 calories. That's why. Let's try increasing this to see how that works. Also, the other thing I would say too, you can change the site of injection. Instead of in your stomach, you can do on top of your thighs or behind your arms. So that can be helpful as well. And reducing it just absorbs a little bit differently in the body. The other thing is the more natural ways for nausea is eating ginger, peppermint aromatherapy, such as sipping on peppermint tea or smelling peppermint oil. Acupuncture or acupressure can be helpful in reducing nausea. Citrusy smells like fresh cut lemon can help. Also, controlling your breathing. A breathing exercise by breathing in through your nose for 3 minutes, holding your breath for 3 minutes, and then out through your mouth for 3 minutes can help with treatment of nausea. And then also you can try vitamin B6 supplement, which can help with the nausea. And then of course, stay active and drinking plenty of water. So I hope this has been helpful for you as far as how to manage these side effects from GLP-1s. Definitely, if you are having severe side effects, definitely go to your primary care or your gastroenterologist, because we may need to check for other disorders or diseases that can be contributing to this. So definitely make sure that you are following up and make sure that they're monitoring you while you're on this medication. All right. Thank you so much for joining us, and we'll see you all next week. Don't forget to like, share, and subscribe. Thank you so much.